I'm Dr. Tara Cortez, Executive Director of HIGN and Professor at NYU Rory Myers College of Nursing. The mission of HIGN is to advance age-sensitive health care for older adults. That is why we have created this initiative to address the growing issue of unrecognized and untreated behavioral health issues among residents in long-term care communities and community-based services. The prevalence of non-cognitive psychiatric disorders among residents in assisted living facilities ranges from 26% to 33%. Older adults need age-sensitive behavioral health care tailored to this population's physical, cognitive, and psychosocial needs. This initiative will educate staff in long-term care communities and community-based services on behavioral health disorder identification and recovery support services. It will also provide guidance on identifying resources and establishing relationships with community-based behavioral health organizations to provide support and therapeutic interventions or programs for older adults. In this video, we bring together experts in geriatric behavioral health and long-term care to describe why they think addressing behavioral health is so important. We now give you the opportunity to hear them.
We know mental health conditions and substance use disorders, collectively termed behavioral health conditions, are common and on the rise among older adults, with an estimated 20% of individuals over the age of 60 having at least one behavioral health condition. Individuals living in care facilities, who are usually of a more advanced age and managing other health conditions, have even higher rates of behavioral health conditions.
We've learned that older adults are more likely to suffer from depression and other disorders as they become less independent. Secondly, we've learned that behavioral health care is inextricably connected to physical health. The better your mental health, the better you feel, and the longer you live. And third, we know from our work that the direct care workforce in the long-term care community has the most impact on older adults and their experiences as they age.
It's important for leadership to understand the implications of these behavioral health issues and the impact it has on the overall health and well-being of the people we serve, as well as its impact on caregivers.
The rising prevalence overall and in these settings, however, has been met with an unprepared system, leading to inadequate treatment for behavioral health conditions and, sadly, poor outcomes for individuals. There are barriers to providing adequate behavioral health and care facilities, which are complex. These include a lack of awareness among facility leaders and staff, pervasive stigma among staff and all of society regarding mental health, poor systems, siloed care models, lack of funds and reimbursement for treatment. The lack of resources for the provision of mental health care for older adults has been a looming crisis for decades.
Providers may attribute symptoms to changes in physical and psychological functioning that occur with aging. For example, some view depression as a normal part of aging. Older adults are less likely to seek mental health care. Research indicates that staff is not prepared to deal with the behavioral health issues in their residents, as few receive training.
Residential facilities can and need to do more to provide information about behavioral health care and then to connect older adults to treatment.
In 2012, the Institute of Medicine, now the National Academies of Medicine, released the report, The Mental Health and Substance Use Workforce for Older Adults, in Whose Hands? And this report detailed the growing behavioral health crisis for older adults and called for action to develop a prepared workforce. Our society has not met the call, and the behavioral health crisis continues and has in fact been intensified by the effects of social isolation and loneliness related to the COVID-19 pandemic.
The New York State Office of Mental Health recently did a study that showed that older adults who received behavioral health care achieved a 70% improvement in depression, anxiety, and substance misuse, a 60% improvement in their BMI, and an 80% improvement in their blood pressure. With outcomes as good as that, you would think that behavioral health care would be readily available in long-term care communities and assisted living facilities. However, that is not the case. The reason why training and education is so important for the direct care workforce in long-term care facilities is that it can raise and build a culture of mental health awareness among all the staff who work on behalf of older adults. That staff will then be given the tools to recognize symptoms of mental health conditions or substance misuse, to know how to handle a challenging situation. And anyone who's worked in long-term care knows that this can happen at any time and often does. To connect adults to a professional caregiver. As a direct care worker, you are often the first person who hears of a challenge or an issue with an older adult. Knowing how to speak to somebody who is confiding in you their issues is a critical part, just as critical as providing physical hands-on care is knowing how to help someone's emotional and mental health needs. In addition, talking about mental health and making a mental health culture of awareness among your staff leads the staff to be able to discuss their own needs. Working in long-term care is a very challenging proposition. Again, especially for the direct care workforce, who often don't have the opportunity to talk about their own experiences working in their facilities. Providing a mental health culture among everyone, from the direct care workforce all the way up to the top of the administrative staff in an assisted living facility, allows for open dialogue, allows for an opportunity for these workers to speak with each other, and then gives them the language and the tools to then have the residents in those facilities be able to talk about their own mental health.
Breaking the barriers to improving behavioral health for persons residing in care facilities can begin today by creating sustainable systems to teach all staff members the knowledge, skills, and attitudes to integrate behavioral health care into routine care. Barriers can be complex to break apart, but they are not unsurmountable. It is vital that staff in long-term care and assisted living facilities be prepared to identify, treat, and even prevent behavioral health conditions. The provision of high-quality, person-centered care requires staff address all aspects of a person's health, and behavioral health is an integral part of overall health and well-being. Strategically planned and sustained education for leadership, licensed staff, and unlicensed assisted personnel is required for the assessment and treatment of behavioral health conditions. The time to begin is now. Thank you.